Hello, it's Katy here. So, you've been had a diagnosis of high blood pressure made. So what tests might you expect to have? Well, apart from having your blood pressure measured, there are 3 very simple tests that your GP or practice nurse is likely to do. The first one is a urine test, and basically this just checks the function of your kidneys. What the practice nurse or GP is looking for is whether there's any protein in your urine. And if there is, it just means there's an early indication that there's mild damage to your kidneys, nothing to worry about, and it's really just knowing about it means that they can keep an eye on it. The second lot of tests are blood tests, and there are 2 tests that would mainly do for looking at your blood pressure, but they might also throw in a 3rd test. So again, they will look at your kidney function, so they will check your kidney function, and that's just looking from inside the body. What's going on there, and is there any other signs of any impairment to your kidneys, showing some early signs of anything. They will also check your liver function to make sure that your liver hasn't had any damage, and these are basically just routine checks, because if your blood pressure is higher, it might be that there's a little bit of damage to some of your vital organs. You would normally expect these to be normal, and if there are any signs of minimal damage, again, it's nothing to worry about. Going on the right treatment will help sort that out, so don't worry about it overly. They might also throw in, for good measure, a full blood count, which is just checking if your haemoglobin levels are normal, because that can also affect how your heart is working. The 3rd test, which you may get at your practice, you may not, you may get referred to the hospital, is an ECG. An ECG is an electrocardiogram, and it basically gives the GP or practice nurse a picture of how your heart is working. And obviously, since your heart is what makes your blood pressure happen, we need to make sure that that heart is working well. So they will attach what are known as electrodes, little sort of sticky pads, which go onto your chest and on your arms and legs, and then they record on one simple sheet of A4 a tracing of your heart. So this gives a picture of what's going on. And again, the chances are that's going to be completely normal. If it does show any signs of abnormal function at all, they are likely to be very minimal, and going on the right treatment and making the right lifestyle changes will actually help sort that out. So you don't need to worry over much about that. So those are the tests that you might expect. I hope this video has been helpful. If there's any other questions that you might want to check out some of my other videos, and if there are still some unanswered questions, do please post me your comments on any or all of these videos, and if you have any other unanswered questions, also post those on either this site or my blog site, www.katygordon.com. I hope this has been helpful.